to Wellness Wednesday on All Sides with Ann Fisher. The Food and Drug Administration earlier in January cleared the way for the sale of abortion pills with prescriptions at retail pharmacies. The federal rule change will not require in-person physician visits to obtain the prescription, except in states such as Ohio, where the state law requires an in-person visit to a doctor first. Dr. Courtney Karistas is a board-certified obstetrician, gynecologist, and family planning specialist in Columbus. She also is a fellow with Physicians for Reproductive Health, and her research interests include medication abortion. Welcome to the show.
Thanks for having me, Ann.
Patients in Ohio are going to have a different standard. Is Ohio unique in this way, or are there other states that also require, no matter what, an in-person visit with a physician?
Ohio is not unique in that this law won't go into effect immediately. In many states, that's because there already is a direct, complete abortion ban, so this will not become a reality for those people. But Ohio is one of the only states that has this requirement that physicians must dispense any medications for an abortion. So that is where we see a barrier to getting pharmacy access in Ohio.
Oh, the Ohio law also requires that the physician dispenses the medication as well.
Yes, yep, it's very clearly laid out that in addition to saying that there's no nurse practitioners or physician assistants, it just has to be a physician who dispenses the mifepristone.
When you get a prescription for an abortion pill, do you have to be pregnant to get it?
At this point in Ohio, yes, because basically our patients have to go through the full screening to find out if they are pregnant, go through consent forms mandated by the state, and then receive the medication abortion pill from the doctor in a clinic. It's because mifepristone has never been available by prescription. There hasn't been any circumstance in which we could just prescribe someone mifepristone just to pick up to have on hand just in case they ever needed it.
And I wanted to just kind of talk about what the abortion pill / pills is and are. I mean, we hear a lot reference to the morning after pill. Is that what we're talking about here?
Nope. So the morning after pill is a very separate thing. It's something we would call emergency contraception. That's to be taken immediately after having unprotected intercourse. It doesn't stop a pregnancy that's already been established. It's just to prevent a pregnancy from happening.
Okay.
On the other hand, medication abortion is pills that are meant to be taken once someone finds out they're pregnant, to end that pregnancy.
And what's the time frame for using the abortion pill? How long? How does it work?
Yeah, so medication abortion, it can be given anytime from as soon as someone finds out they're pregnant, so potentially 4 weeks along after the last period, up until about 12 weeks gestational age, so about 10 weeks or 8 weeks after that person would have found out they were pregnant. Due to another regulation in Ohio, we have to follow exactly the FDA guidelines for providing medication abortion, which means we can only provide it up until 10 weeks into the pregnancy.
Even though it might work up to 12 weeks.
Exactly.
And how does it work? What is it doing?
So the medication abortion, it's a combination of two different pills. The first one, mifepristone, basically stops the pregnancy from developing and primes the uterus for the second set of pills, which is called misoprostol. Those pills are taken about 24 to 48 hours after that first pill, and that really makes the uterus contract and pass the pregnancy, very similar to the natural process that would be happening during a miscarriage.
And I was surprised that how often medication abortions are done.
Yeah, it's been increasingly common over the past several years. Medication abortion, the mifepristone pills were initially introduced in the U.S. in 2000, and their popularity has really skyrocketed over the years. In 2020, the most recent national data for medication abortion, it accounted for 53% of all abortions in the U.S., so over half. And I think that's for a few reasons. One, people like the convenience of being able to take these pills at home and pass the pregnancy on their own. They don't have to have an invasive procedure for the abortion. And it's a lot easier, especially in states where things like telemedicine for medication abortion are available.
But not in Ohio.
Of course.
Right. Yep. Just to continue to clarify, this isn't happening. This is what's not happening in Ohio. The legislation, I know that the Attorney General has asked the state Supreme Court to reinstate the 2019 law banning doctors from performing abortions after cardiac activity is detected. That would still permit the use of abortion medications, right?
Yes, yep. And while the ban was in effect over the summer, we were able to still provide medication abortion just for a very, very limited number of people who were able to get into the clinics and know they were even pregnant before that 6-week time.
Right, that's kind of the trick. You can, how early can you find out if you're pregnant now?
The best pregnancy tests out there are maybe going to detect it a couple days before a missed period. So at, 3.5 weeks pregnant.
What do pregnancy tests measure? What are they reflecting?
So it measures the HCG, the pregnancy hormone, or human chorionic gonadotropin, the levels either in the blood or in the urine. So those only start becoming present at that time frame, that 3.5 to 4 week time.
When you use an abortion, that two-prong, two-drug medication, what does it feel like?
So for patients, it really is a wide spectrum of how they feel. Usually with the first medication, the mifepristone, people don't really feel anything. They can go about their day normally, might have a little bit of cramping, but that's really just priming everything. And then after the misoprostol, I usually describe it as feeling like a worse period. So heavier cramping, more bleeding than a normal period. But that typically occurs over about a 24-hour time frame with that heavy bleeding and cramping, and then subsides at that point.
And are there any downsides to it?
For some people, it's just, the not knowing exactly how long that bleeding cramping is going to take, not having a definitive endpoint, versus when we do a procedure in the clinic, we can tell them exactly, you are no longer pregnant at this time. Mm-hmm. You can go home and have that peace of mind. So with the medication abortion, that endpoint is a little bit less clear, although it's still very, very safe, very effective.
Abortion service providers, are they geared up? Do they direct people to other states if they need to get them?
So at this point in Ohio, we still have clinics operating and up to our full gestational age limit, so we haven't been having to direct people to other states, although we are receiving people from West Virginia and Kentucky.
Where there's complete bans in place.
Exactly.
Yeah.
Exactly. But if our wait times are too long, or because we do have such a high volume now of people coming in from out of state, plus people in Ohio needing abortions, I think patients themselves may seek out going somewhere else if that's feasible for them.
Let's see, I should ask my questions in the order that I'm thinking of them, but you just made me think of something. How they count the rate of abortions in Ohio, will they take on the West Virginia, Kentucky numbers, and that will automatically reflect Ohio? Or do you guys have to do abortion providers have to keep track of where the patient comes from?
And it kind of depends on what reporting system we're looking at. When we report abortions to the state, we are saying just this abortion happened to Ohio, and
okay,
that's the number coming out. But a lot of the research going on is also asking the patient's state of origin, or where they.
Is that going to suggest maybe an uptick in abortions when in reality you're just concentrating them?
It may, although I don't know that our capacity for providing more abortions has really increased that much to fully take on people coming from other states, plus taking care of people in Ohio.
I would imagine if they make it harder to get the abortion pill, the two-drug medication, that people might look for other avenues. They don't have the time or the resources to visit a doctor. They may try to go online. What are your thoughts about that? And is there any cautionary tales out there?
Yeah, so medication abortion, whether it's provided in a clinic by a doctor, given to them at a pharmacy, or even mailed from another state, or what we would consider self-managed abortion. Across all of those, it's very safe, very effective. We have data from not just in the U.S. but around the world about that safety and efficacy. However, really the risk that exists in the United States when people are trying to get medication abortion pills on their own is the legal risks. We don't know, people have been prosecuted in many states for self-managing abortion, taking these pills on their own, and not necessarily using any particular laws that say you cannot self-manage abortion. They use all sorts of different techniques to get at these people.
Because we always hear that they don't want to criminalize the pregnant person.
Exactly.
Yeah.
But that hasn't held out to be true, with people being prosecuted for things like feticide or child neglect or child abuse in these cases. So while I can say from a medical standpoint, as long as the person is fairly certain they're within that 12 weeks time frame, it should be safe and effective. I can't say from a legal standpoint that people would not be at any risk.
And, given the fact that the Attorney General has asked the state Supreme Court to reinstate the Heartbeat Bill is its familiar reference, but it bans doctors from performing abortions after cardiac activity is detected, which is at about 6 weeks. So that would include the 2-pill abortion medication as well, right?
Mm-hmm. Yes.
Any sense about how this legal back and forth over the issue in the courts impacts abortion services in Ohio?
I mean, abortion services in Ohio have always been under this legal threat, or we've been dealing with different threats from the state for a long time. It does make, our clinics be trying to prepare for providing all the care we can right now, but knowing that there is a potential that the 6-week ban goes into effect again. And then clinics aren't able to, serve as many patients. They may not be able to retain staff at that point, and it is a very hard position for clinics to be in, not knowing their stability in the future. But like I said, we've been dealing with this for years and years and are fairly ready and flexible to make the changes we have to make to still provide the abortions we can.
What is the atmosphere outside clinics in Ohio? Is there a thumbnail you can give us about what kind of demonstrations are going on, kind of what's happening right now?
There are always protesters outside the abortion clinics. Pretty much there were before the Dobbs decision. They continue to come afterwards. They have large posters and signs and people who are yelling at our patients coming in through the doors. Luckily, we also have a great group of clinic escorts who help, get the patients from their car into the clinic doors without having to listen to all the other talk from the protesters going on. But that's been an ever-present force outside of our clinics.
Well, Dr. Karestas, thank you so much for your time today. I really appreciate it.
Thank you so much for having me.
That's Dr. Courtney Karestas. She is a board-certified obstetrician, gynecologist, and family planning specialist in Central Ohio. She's a fellow with the Physicians for Reproductive Health, and her research interests include medication abortion. We have more Wellness Wednesday coming up, so stay with us. This is All Sides with Ann Fisher on 89.7 NPR News.